Hi everybody, it's day 4, 3 days after my spinal fusion on my L4, L5 lumbar vertebrae and disc. It's been different. Today I finally got discharged from the hospital because I was doing so well with physical therapy, walking up and down the stairs, everything, but man, it's exhausting. I mean, you take so many things for granted. Like, I'm just gonna walk up these flight of stairs beforehand, or I'm just gonna walk from here to the bathroom, and it not be a whole body and a whole exercise. I mean, every part of my body hurts. My forearm hurts from using the walker. I mean, my stomach hurts from being so bloated for so long. I mean, when I got out of surgery, you don't realize being face down how much bloat and air you fill up with. You'll probably see in my first video that I don't really remember taking, but I was so bloated. And, you probably see from here on out my face getting, smaller and smaller with bloat, but I'm still dealing with some of the side effects, the gassiness, the upset stomach, the not being so hungry. But the one thing you always have to keep up with is fluids. And as of yesterday, they did everything possible to have me use the bathroom, and they did milk of magnesium with prune juice, and that finally did the trick. But Lord, I mean, you don't realize that sucks, They sent me home with oxycodone every 4 hours, Valium for muscle spasms that you can get in your back after surgery. I felt a few of them, and it just feels kind of like a pinching. That's every 6 hours, and then a Miralax to help, use the bathroom on top of like the stool softener, gas X stuff that you normally have, and that's once a day till you really get regular with everything. They did say the first week would be awful, and I completely understand. I saw my doctor this morning, and he said I'm doing great for everything. I do have my left leg, as I said before, was the bad leg. From my buttocks to my knee is pretty numb on the outer side of my leg, and I'm feeling more pain on my right side, and it's not pain, it's more surgical pain right now on my right side. Other than that, I'm home, thank God. As you could tell, the bed scene's probably a little different, but it's easier to lay down and do these videos because I am a hot mess when I sit up. I mean, you have to come home, and they don't tell you before you have a spinal fusion all the things you need. I mean, you need a toilet extender, excuse me, in case your toilet is a little lower, which ours happened to be, but I realized at the hospital, especially for a female, if you kind of straddle the toilet, it takes so much weight off of your lower back, and you put it all in your knees, which is what you're supposed to do. And with a small toilet, you don't want to have to constantly bend because you have to use your knees to get back up. So getting a toilet extender is fantastic. It makes a world of difference. A shower chair, since you want a shower, which becomes kind of a luxury at first. You kind of stick with washcloths, baby wipes, just getting your hair done when you can and everything. And most guys don't seem to have a problem because they have the short hair, everything. But women need to have a little bit more cleanliness about things. So a shower chair is a lifesaver. And then, handles. They're super cheap. You can get probably like a 2-pack for like $20, or, a one of them for $8 that you can attach to things and help pull. And that makes a world of difference. And especially your bed. The bed that you go home to, it's so amazing compared to what you had in the hospital. And make sure, I'm not sure if you can see my sheets, but they're a little bit silkier, so make sure you can have a silky sheet that when you do your log roll and you get on your side, you can kind of shimmy yourself over, and it's great because it's so silky, and your bed sheet's so silky that you glide, unlike at the hospital where it's so much more effort because it's so starchy and there's no movement with the sheets at all. But you can do it, and I know it may be awful, absolutely awful, day 3 and day 4, which today is day 4, but it gets better. It does. And just makes and I feel it. And for being in pain for so long, it just, it gets you, you feel better. And even being in pain from the surgery and everything like that, I feel better. It's just, everything may hurt and it may ache and I may feel super weak, but I see the light at the end of the tunnel. So just don't give up, and I'll keep you updated tomorrow. So probably the medicine has me emotional too. So, but I'll give you another update tomorrow on day 5, and hopefully things are a little bit better.